As we continue this training and you learn more about your role as an exercise specialist, and then go into our clinic and begin practicing your role, you'll start to learn that there's something that happens quite a bit, where you feel uncertain about where your jurisdiction ends and where our provider's jurisdiction ends. What decisions am I supposed to make? Which decisions am I supposed to take to the provider? Well, we hope to be able to speak peace to your mind in knowing that we as providers take ownership over our patients, every exercise that they do, and their entire program. All of this together we call the plan of care. Any plan of care decisions will be made by the providers that are working with those patients. We want to take that weight off of you, but we hope to champion you in other ways that you can help us with. You are the masters of the patient's flow and of being able to communicate to the providers valuable information, which will inform our providers and inform their clinical decisions that will help us create the best plan of care for our patients. There are things that happen each day that call into question what decisions are mine, what decisions are the providers. And in these moments, especially early on, we invite you to go quickly to the provider that's working with the patient that day and ask them that question. This will be an invaluable training ground for you to learn the principles of rehabilitation, to learn the principles of more physical therapy that lead to patients leading happier and healthier lives. As you ask questions, you're going to be met with encouragement. You're going to be met with somebody who's there to support you and lift you up. I know that's how I felt early on when I had questions. I'm so grateful for others who are willing to take the time so that I can learn what I know now in preparation to become a PT. We hope that you have the same experience. If you're not, please let us know. We hope to be able to make this better for you. In addition to asking questions to our providers, we also ask that each time you receive an answer, you add it to your database of knowledge, that the next time you see this principle and this situation come about, that you can apply that principle and do so with confidence as an extension of what we would do in that scenario. Again, if you have questions and doubts, please ask again. We will be supportive of your learning. But we hope that you again take ownership over your abilities, that you can feel championed to do your job well, that you don't feel that you have to ask every question to the provider every time as you begin to learn the patterns of rehabilitation. In fact, as you start to learn more and grow in your training, we expect that rather than coming with questions to that provider, that you might state what happened with the patient or what question they had to the provider and say, here's an option number one or here's an option number two. Which would you prefer? This helps a provider who's busy taking care of other patients and has a lot on their plate to be able to quickly arrive at an answer for that patient's plan of care. As we do that, we'll work together effectively to make sure that we're creating the best program for that patient. As you come proactively and provide your thoughts and your ideas, you're only adding to our team and making us better. We expect these suggestions to come in the first few months. And as you grow even further into your role as an exercise specialist, we expect these propositions from you to come even quicker and even easier. They'll become more natural, that you'll begin to understand and truly feel like an extension of us as a part of our team. If you ever feel like a decision is above your pay grade, or that you feel uncertain in any way of how to answer a patient's question or concern, or how to even teach a patient an exercise, please stop and ask. Oftentimes, new exercise specialists worry that they will come across as unconfident and incapable of performing their role. However, in my experience, as you say to a patient, you know what, that's a great question. Let me ask your provider today. I'll be right back. Or, you know what, I'm not certain that we're doing this exercise correctly. Let me grab your provider and have them look at your form and give you correction. That patient will look at you and have more confidence in your abilities. They will have confidence that you're going to a source that will give them the right answers. And as you are exposed to these right answers, we would invite you to listen and learn from what that provider teaches that patient. Listen to the answers that they give. Listen to the cues and corrections that they give during the exercises. These are the same answers, cues, and corrections that you can give over time as you become empowered in your role.